Hi, I figured I would start my second video answering the questions from my first. So, first of all, will radiation hurt? The short answer is no. The long answer, radiation can cause side effects, which may cause you some discomfort. So, let's break that down. Radiation is essentially just high-powered x-rays. So an x-ray that you would get to check for a broken bone. Same family, we just use much higher power. And the radiation itself doesn't feel like anything, just like an x-ray. The waves pass through you, you don't feel a thing. And then, like I said, part B to that answer, depending on what area of the body you're having radiated, the side effects will vary. Radiation is a very targeted therapy versus chemotherapy. Chemotherapy affects all of the cells in the body. Radiation is targeted to the specific area in which we're trying to treat. So, the side effects associated with your radiation treatment will be specific to that area. I won't get into that in this video, but do know with the treatment do come side effects. They don't happen right away. We say they're cumulative. So as you have more and more treatments, the side effects do start to come on a little bit later. The second question that I had in my introduction video, is it safe? It's 100% safe. It is also effective for certain cancers. When I say, is it safe, I guess people are probably asking that question wondering, can I be around my family and friends? Am I radioactive? A funny one, of course, is, will I glow in the dark? Unfortunately not. You won't. You won't have that superpower, but you are completely safe to be around your family and friends immediately after treatment. The radiation doesn't stay inside of your body. How it works is it damages the DNA of the cells as it passes through, and it completely exits your body, gets absorbed into our table, the floor, and then it gets whisked out of the room with the airflow. So now that is talking about external beam radiation, which is the most common type of radiation that people get. We also we also can perform internal radiation for certain types of cancer. And in that case, sometimes the radioactive source stays in the body, and sometimes it stays for a short amount of time and is removed before the patient leaves the hospital. So that's a little bit of a different case, and if you are going to have that type of radiation, your care providers will break that down for you as to what's safe and what's not. I can get into that down the road. And then what actually happens during radiation treatment? So you are alone in the treatment room when that radiation is actually being delivered. Your therapists will take you into the treatment room, and we can monitor you at all times. We have video monitoring, and also audio. So we can see and hear you at all times. And if for any reason you ever needed help, we can come right in. You just give a shout or a wave, and we can stop the radiation, head on in, and help you. Saying that, again, we don't anticipate that you'll need help from the actual treatment. But if something else is going on, like you're having a coughing fit and you need to sit up, or if you feel nauseous because you're also having chemotherapy, anything like that, we are always there and we are always able to come in and assist you. You aren't alone. Okay, so once you get into the treatment room, we will set you up into the treatment position that was selected for you at it's called a simulation appointment. And I'll get into all the different steps of the road down in another video. But for the treatment itself, what we're going to do is replicate that same position as you were planned in, okay? because we want it to be precise. You don't get into this career if you are not a perfectionist. So we are going to lay you on our treatment table in that same position. Oftentimes, now depending on what center you have treatment in, they may have different ways to localize the area that we're treating. The most common though is that they will give you at your simulation appointment some little tiny tattoos. So this may be the first time in your life you're getting a tattoo. Now, I can show you, I have some because when I was a student a long time ago, we used to practice on each other. And so, forgive my cat scratch, but this little dot here, that's one of the localization tattoos. I have a really poor one over here. You can barely see it, but that's all it is. Oftentimes we'll give 3 or 4 little dot tattoos, and we use those to line you up every day for treatment. So those allow us to use our in-room laser coordinate system to get you straight and level. Your biggest job is to just lie nice and still. I always say like a sack of potatoes. One of my coworkers says like a sack of gold, whichever you prefer. But we're usually moving you millimeters, okay? So we want to get you straight and level, just like you were in that CT for your simulation. You do come up and under the treatment machine. It doesn't touch you at any point. It just rotates around you. Everything rotates around you, and you just have to lie nice and still. It may come close, but again, it won't touch you. So once we've got you into your treatment position, the therapist will leave the room. We leave the room, and we usually start with some localization images. That may be a quick x-ray or a little mini CT scan. And in some cases, a little mini MRI. Some centers have that capability. And what that does is allows us to see your exact position on our table in that moment. And then we compare it to your exact position at your planning CT, your simulation appointment. And we want those exactly the same. So based on your today picture compared to your simulation picture, we can make adjustments to your position on our table from outside the room. Sometimes we have to come in and do some manual adjusting, but most often we can fix things from outside the room. You'll feel the bed do a couple of clicks, a little bit of movement, and then we have you in position. From there on, the radiation will start. The machine again moves around you, delivering the radiation. You don't feel anything. You don't see actual radiation. This is the machine going past, okay? And depending on your treatment plan, that may take anywhere from 5 to 10 to 15 minutes or longer for certain specialized procedures. But you breathe normally. For the most part, there are exceptions. I can get into that at a later video. After you're done, again, you don't feel anything. We come on in, get you off the table, and send you on your way for that day. So it's oftentimes patients, when I get them down after their first treatment, they're like, did you actually do anything? That was it? Oh, that wasn't so bad. So I hope this helped answer those first few questions from my introduction video. If you have questions of your own, please leave them in the comments. I will be constantly reviewing the comments for questions that I can answer in future videos. Thanks for taking the time to watch today.